Hey, Team BCN. Thank you so much for listening to today's podcast episode. In this episode, Lizzie Eubank, Executive Director of the Department of Medicine, joins us to talk to us about her journey, a little bit about what she does, and why she enjoys working at Bluegrass Care Navigators. Lizzie, thank you so much for joining us today.
Thank you, Heidi, for having me.
Yeah, of course. So, if I've done my research right, you worked at BCN for 11 years now. How did you come to BCN?
Yeah, it has been 11 years. So I came to BCN straight out of college. We did have a close family friend who worked for the organization, and through her, I was able to be introduced to Sandy Gowdy, who at the time was over extra care. And she was able to find me PRN work here and there in different departments throughout the organization. So that's really where I started. That is really also where I, found my love of this organization. And from there, I got the opportunity to join the Department of Medicine as the administrative coordinator and was in that role until, I guess it was fall of 2019, so right before the pandemic hit, and that is when I moved into my current role as the executive director.
That's awesome. So I'm very new, and I recently came through the onboarding experience. And one of the things that they asked us was why BCN and why now? So I'd love to hear what is your why for why you work at BCN.
Yeah, so I love our organization's mission and I love our vision. I enjoy the collaboration that we have, not only between team members, but between our different departments. Um, I love the dedication that our frontline clinicians have to patient care. What we can offer those in our community. Another thing that I love is, when you're out and about in the community and somebody who has used our services before, whether that's hospice or primary care, or palliative, or a dementia program, when they hear that you work for our organization, they just all of a sudden start flooding you with the praises that they have for us. And it's such a good feeling to have.
Yes, for sure. For sure. I've experienced a tiny little bit of that already just being here about 6 weeks or so. So it is really awesome.
Yeah.
One of the primary things that you do in your role, one of the primary areas that you're over as executive director of Department of Medicine is palliative care and primary care. Could you tell us a little bit about each of those two areas?
Sure. Yes, like you mentioned, palliative care and primary care are out of the Department of Medicine. So, as we know, palliative care is specialized medical care with people living with a serious illness or illnesses. And one of the main focus of palliative is to provide, symptom relief from those serious illnesses. Another goal is to improve the quality of life, not only for the patient, but also the families and the caregivers. Our palliative teams are made up of a combination of physicians and nurse practitioners, nurses, social workers, chaplains, CMAs, our amazing admin staff, and they're really there to support not only the patient, but the family and the caregiver. We currently see patients on an inpatient palliative consultative service at 3 hospitals. Those hospitals being Baptist Health Lexington, St. Joseph Hospital, Maine, Baptist Health Corbin.
Mhm.
Also see patients in long-term care facilities and in the home setting for palliative in Northern Kentucky and in Lexington and Jessamine County. We also have the wonderful opportunity to collaborate with Georgetown Community Hospital's oncology team on an outpatient palliative care clinic there at their hospital.
Oh, wow.
Yeah, it's very exciting. They've asked for that for a long time, and I'm so happy that we can finally bring that to life for them. Of course, we have our amazing pediatric Bright Path team who sees our peds patients. They are seeing patients in Central Kentucky and in Northern Kentucky. And then as far as primary care services, we see them in the home setting in Lexington and Nicholasville. And we also see primary care patients within the 3 Willows facilities in Lexington. So Willows Hamburg, Willows Citation, and Willows Fritz Farm. not only do we see those patients for primary care, but we also act as the medical director for those facilities.
Okay.
Exciting too. Yeah, one of the major goals of home primary care is, how can we minimize negative outcomes such as, reoccurring hospitalizations and ER visits? How do we maximize the positive outcomes such as quality of life and functionality and, keeping these patients living independently as long as possible?
Definitely, definitely. I don't think I'd realized as I'm learning about BCN, I don't think I'd realized quite the scope of what you guys do. That's really awesome.
Yeah, we do a lot, don't we?
You do. You do. What does a day in the life of Lizzie Eubank look like?
Oh my goodness. That is a great question. How it changes day to day. Right now, I think we're all consumed with a lot of meetings,
Mhm.
um, which is a good thing, working on projects, pulling data. Yeah, it doesn't seem very exciting, but meetings and collaborations with people in different departments on projects.
Yeah, yeah. What do you like to do, for fun when you're not in meetings?
Yeah, so when I'm not in meetings, I love to hang out with my family and friends. They are a big part of who I am. I have two boys, and when the weather is nice, we are always outside, whether it's playing t-ball or soccer or riding bikes to a park that's near our house. My husband and I love all things UK sports, so
Yes, go Cats.
yeah, go Cats. Football games and basketball, and I have a new love for UK baseball games.
Really? I have not been to one. What are they like?
Yeah, they're fun. You can go like, I don't know, behind the outfield and watch there. And I have a 4-year-old who is really starting to get into sports. So he is all about any type of sporting event that comes his way.
Yeah, yeah, so it sounds like a great time all the way around.
Yeah. Also
Yeah.
read and travel, of course, and cook.
Yeah, yeah, that's awesome. So one of the words that was mentioned to me as I was interviewing for my role at BCN was that a lot of people who work here kind of consider it a calling, if you will, to work in healthcare. When did you first know, coming right out of college especially, when did you first know that healthcare was right for you?
Yeah. So growing up, I always wanted to be a nurse. So that is not the avenue that obviously I took
Yeah.
college because I am not clinical. I am strictly admin. Um, but working in healthcare in an administrative capacity, you still feel part of the system.
Mhm.
So, I love, working on operations and workflows that truly in the end do help patients. I love working with the providers and the medical teams. So it might not necessarily be hands-on, but I still feel like I'm in the healthcare field, which is,
Yes.
just grateful for so many lives that are touched through all of our service lines, whether administratively or clinically.
Mhm. Yes, that's one thing that I love too, because the reason I laughed when you said you wanted to be a nurse was because I also thought about being a nurse, but then I'm kind of realizing that that's really not something that I'm cut out to do.
Yeah.
Um, and so I just love it that there are other ways to be part of a team that's helping people.
Yeah. I feel like, when I meet people and they find out that I work for Bluegrass Care Navigators, they're like, oh, that's got to be really hard. And I said, well, I don't do patient care. That is for our amazing frontline clinicians. But, I do still feel like I'm a part of the team.
Yes, yes, for sure, for sure. So even though both of us are in administrative roles, we all have difficult days. Can you tell me a story or something that comes to mind that keeps you going when it would be easier just to throw in the towel?
Yeah. Gosh, I don't know if I have a specific story to tell, but many times we have very long days, and sometimes I'm just tired. Everybody gets burnt out, and there are times where I do want to throw in the towel. But I think what really keeps me going is the fact that I absolutely love my job.
Mm,
I
mhm.
love this organization. Um, I love my teammates and my coworkers. And a little bit of me feels like, me throwing in the towel, that trickles down, meaning somebody else is going to have to pick up my work.
Mhm. Mhm.
And that's not who I am. So it really is just remembering my why.
Yeah. Yeah. That's good. As you probably know, November is National Home Care and Hospice Month. And of course, we're grateful for all of our team members every single day. But this month, we're especially focusing on that. As you reflect on the work that you and your coworkers do, what are you especially proud of and grateful for?
Yeah, so I'm proud of might not be personal, but I'm proud of our organization and the quality of care that is provided to our patients and the dedication from all team members, like I mentioned, whether you're clinical or not, to provide that care. I feel very lucky to work, in such an innovative organization and just very grateful for the number of lives that have been touched through our different service lines.
Definitely, definitely. So we've had a really good conversation, Lizzie. Is I have one question that I ask everybody who comes on, but before I do that, is there anything else you'd like to say that I didn't know to ask you?
I don't think so.
All right, that's okay. That's great. Some people do and some people don't. There's really no wrong answer to that question or any of the questions I ask you. It's very low pressure. Um, but because this podcast is about getting to know our team members and what they do and who they are, what is one thing that others may not know about you?
Oh gosh, I feel like I've grown up here.
Kind of, you have since you came straight from college, right?
Yeah. I got married while I was here, had both my children while I was here. One thing that people might not know about me is I used to be a competitive springboard diver.
No way. That's awesome. How long
Yeah.
did you do that?
So I started, let's say 10 years. I started when I was about 8, got hurt, and pretty much ended that when I graduated from high school. Uh,
Wow.
but I was lucky enough to be a member of our USA diving team until I did get hurt. And through that, I was given so many opportunities to compete worldwide and to visit different countries. And it also gave me the opportunity to be inducted into my high school's athletic hall of fame. So
Lizzie, that's awesome. I feel like I know somebody famous now.
no, no, no. But yeah, that was, a big part of my childhood growing up was that.
Yeah. Yeah, that's really cool. What was one of the favorite countries that you visited?
Oh gosh, probably Amsterdam
Okay.
or
That's
Germany. Yeah.
yeah, that's really cool.
Yeah.
Well, Lizzie, it has been great to have these few moments to get to know you. Thank you just a little bit. I know there's like way more to your story, but I really appreciate you taking the time to give us just a little snapshot of who you are and what you do. So thanks for coming on today.
Absolutely. Thank you for having me. It's been a pleasure.
Yeah, anytime.